Thank you. Dr. Gibbons, you were either having your best day or your worst day because you hadn't gotten a question yet. So I wanted to ask a question about an NIH study through your institute that found higher mortality rates for patients on respiratory support in rural intermediate care units. This goes to the heart of what I talked about earlier. Obviously, I have a large rural population. What advice would you give, or what do you think can come out of this study in terms of helping rural intermediate care facilities be able to change the results of this study?
Oh, thank you, Senator. You bring out the important aspect of your earlier comment, in which we recognize that rural America and our systems need to focus in on where the burden and suffering is the greatest. Clearly, when it comes to intensive care units, there's actually a lower proportion per capita in rural communities, and we know that it is a challenge. We're hoping and we're testing strategies, many of which involve telehealth, in which we can ensure that the care is at the level where we can improve those rates of recovery in the context of rural communities. For example, one of the other elements of that challenge involves chronic pulmonary disease, in which we know that pulmonary rehabilitation can actually reduce hospitalization rates for those with chronic obstructive pulmonary disease. And we've tested that in rural settings and shown that it's effective in the context of where patients are in rural communities. Similarly, we have established cohort studies focused in on rural communities to understand the whole trajectory of the development of chronic lung disease and heart disease. Our rural initiative in Kentucky, Alabama, Louisiana, and Mississippi, so that we really want to be where individuals are to understand their risks and improve their care. Including the use of a mobile CT scan to further understand those things. So.
Good. I was just talking with one of my West Virginia University doctors about a mobile unit for more to look more at heart. I just want to thank all of you. This has been, it's just so informative and hopeful. And also, my last comment would be to you, Dr. Bortagnoli. 27 institutes. That's a lot to manage, not just physically manage, but there's so much interplay between what's going on. Anything, and as we look at a time of dollars shrinking or not, we got to be more efficient. So any efficiencies, and I'm not asking you to speak on this, any efficiencies that can be found across the 27 institutes, I think you're going to reap the results of that. And I know that's something that you and I talked about earlier. So thank you all very much. Appreciate it. Thank you, Senator Shaheen. I haven't voted yet, so.
Senator